All right, guys, welcome back to the podcast. Today we're going to do cervical spine or neck problems. We had a request for this because we did one a while back on low back pain and significance of that. But boy, we got a lot to talk about with neck pain. I got this thing summarized. We'll look at some stats first and a little bit of anatomy, then go over a couple exercises because a lot of people don't exercise their neck, right? A lot of guys have, and young people in general go to the gym, they work on a lot of stuff. They burn a lot of calories, work in the big groups, the quads and upper body, but they tend not to get to the neck muscles. And the neck is pretty gentle. And I see why people kind of leave it out of the picture. It takes some, basic instruction on how to do that. There's a bunch of devices out there that people use. So we'll go over that as well. But first thing to know is that neck problems are epidemic, right? We have headaches that come to the neck, arthritis. Average person over 60 years old has moderate to severe arthritis in their neck already. Younger people are dealing with all kinds of problems, and I found something really fascinating. You may have heard this because it kind of made mainstream news a little bit, that there's an actual bone growing out of the back of younger people's heads. And it's kind of bizarre because there is something called the external occipital protuberance, EOP for short, as you'd imagine. And if you look at the back of a spine, now here we have a cervical spine. This is the base of your head or the back of your head. This is the back of your neck, and your shoulders would be right about here. This little knob right here is an attachment point for something called the nuchal ligament. Now, that's a very strong ligament, so it's one of the many things that stabilizes the neck. One of the problems of looking down for long periods of time is that there's a tractioning effect or a pulling on that actual bony prominence. And due to that stress, the bone is actually thickening and the ligament is actually turning to bone. And they're able to actually feel this growing on the back of some kids' heads. Now, the average person I looked up is on their cell phone 4 hours a day now. And, younger people are on their cell phones more than older people classically. And that's causing serious problems over time, from migraine headaches to shoulder pain, numbness, tingling in the hands. And we see this in our office all the time. So let's go over just a little bit brief anatomy first. The neck is designed to be in a curve. There's 3 curves in the human spine: the cervical, the thoracic or middle back, ones with ribs, and then the lumbar or the low back. People are familiar with that because lumbar supports in cars, that kind of stuff. The middle back, you see, deformations in like people with a hunch on their back, what they call a Dowager's hump, where people are, leaning forward so often, looking down so often, they actually start to bend over like the hunchback of Notre Dame. So spines are just, the curve in the neck is supposed to be 30 degrees. And if you take the average banana and you take a look at that curve, that's around 30 degrees. And that is designed to absorb shock as the weight of our head is driven down into our shoulders where we have our ribs and a lot of stability. So if the curve is missing, that shock absorption is missing, and all that shock that isn't absorbed there is transferred down to the middle back or the low back into the legs and the knees, and our head is acting like a little bit of a hammer, pounding into different parts of our spine improperly. We end up with problems all over the spine. So a lot of people have neck issues, not pain, but mechanical problems, positional problems that lead to disabilities in other areas, the low back and even the middle back. So going over this is crucial, and understanding how to get rid of this stuff. It really isn't that complicated, but it's pretty much being ignored. I looked up, the primary reasons we have an increase in neck pain in society right now. It's simple, computer use, of course, that's easy. Cell phone use, I mentioned that a second ago. Workplace ergonomics is another one. A lot of times we'll have the standing desks, even the treadmill workstation I've mentioned in other podcasts, which I'm a big fan of. But in the end, are people really attending to the angle of their neck? They might have their low back supported, they might have their keyboard somewhat right, and that adds to a good neck position. But if you have your chin up high enough and you're not mindful that there is a curve that's supposed to be in your neck, you're going to end up looking down too much. And different types of eyewear, if people's glasses aren't right, getting the screen high enough. Most people's screens are not high enough. They're usually about 2 or 3 inches too low. Even by some ergonomic experts I looked at, I still felt the screen was too low because the height of someone's trunk varies from one person to another. Some people are all legs, other people are all trunk. So they're sitting in a chair, and that tends not to line up properly. And the fourth most common reason for growing neck pain is carelessness, People just not attending to their cervical spine and not getting treatment for it or looking up how to do it. I looked online. There's great books on exercise. We'll put one in the links in the end here on how to exercise the neck in very subtle ways. And I'm going to go over a couple of real brief ones at first. But a few more stats. 75% of the population will experience neck pain in their lives. 75%. So, that it's 85% for lower back. So it's up there. It's getting close. 5% of these will become disabled, and 30% will live with chronic neck pain. So, big problem. The fourth leading cause of disability worldwide is neck-related problems. And, you can imagine it happens from car accidents, from chronic improper posturing, the stuff we're talking about, which is, you obviously can do more about that. And sometimes it is just simply on a chemical plane. People are dehydrated. Their discs aren't given the right water to be able to absorb shock. The obese are more likely to develop neck pain. Could be the inactivity, could be the poor diet, could be hormonal. Thyroid issues are right in the neck. The neurology to the thyroid is from the neck, so as chiropractors would pay attention to that. And women are 1.38 times more likely to have neck pain than men. And I looked into this more, and I knew this from before from doing working with auto accident victims and the writing reports for these individuals, that the head neck ratio of a woman and a man is very different. In other words, a woman's head is bigger in a ratio than her neck, and a man's head is not as much bigger than their necks. And I can think of my father, he's a pretty big, stout dude, and he had, when I told him there were 7 vertebrae in the neck, he cackled and said, "Well, not in me. I don't think I have 7 in my neck," And by looking at him, it was surprising that he would have 7 vertebrae somewhere buried in there. But he did. We took an X-ray of his neck, not for that reason. I knew there were 7 in there, and I sort of counted them out for him, and he was impressed, right? Because my neck is obviously 7 vertebrae, but he was just one big size guy. But anyway, so getting into a couple more things, the pressure in the neck. I think what's interesting, the pressure in your neck magnifies exponentially when it comes out of position. Now, a head weighs 12 pounds. Your neck probably weighs about 7 pounds. But as you start to bring the neck forward, the pressure doubles. For every 15 degrees of looking down, the neck goes up about 15 pounds. So when you look all the way down, your head weight goes from 12 pounds to 60 pounds. So when I'm looking down, my 12-pound head turns into a 60-pound head from a force and pressure standpoint on the discs and on the surfaces of the joints in the neck. It pulls muscles. And in younger people, because their bodies are turning over and so active, they're growing the bone in the back of their head, which, it can't be good, right? I mean, it's a crowded area, and there's a lot of neurology, a lot of muscularity, many layers for fluids to move through and around the brain and spinal cord. And as a chiropractor, one of the things we pay attention to, and some chiropractors pay very, very specific attention to, is the first couple vertebrae in the neck, because there's a brain stem there. Now we have brain stem, then spinal cord, and it gets a little less important as you go down. It's all important. It's neurology. But the brain obviously is running the show, and then the brain stem has some of the more primal things in it, and then the spinal cord is running the body. And if there's interference in there, one of the primary premises of the chiropractic profession, there are problems with neurology. So the brain cannot communicate with the body properly. And if you pinch it off at the very top, you're basically cutting off a good portion of the impulses to the body and back to the brain. Communication can be thrown off. In the short term, of course, you can deal with simple neck pain, arthritis, that bone we're talking about, as well as some pretty severe headaches. 80% of headaches come from the neck. We did another podcast on headaches. So, it really is something to look at and get involved in. So let's go over a couple of questions. Now, first is, I looked up some popular questions. I had some patients, what are some questions you would have about the neck? And one was, what is text neck? Text neck was a term coined about 4 years ago. And because of people were texting so much, their necks were a problem, and it's, once again, like I said a minute ago, it's from the chronic down. You take away that 30-degree curve and you start to make it flat, or actually a negative curve. So you're going the opposite direction. And that pressure builds up. You end up with that 60 pounds in the discs, and that over time breaks the disc down, squeezes all the water out, changes the fluid ratios, and creates distortion. It would be fine if you looked down and you came back and you went right back into position. We tend not to. Over time, we start to lose that curve, and it becomes a semi-permanent. In other words, until you do something very direct to that cervical spine, you can't really get it back. Chiropractic adjustments are primary for that. There's also devices, neck curve restoration devices, one called the posture pump, something I recommend to patients. You can look that one up. And there's other more involved devices, but I'm going to give you some basics with it when we get to that part of the talk. Can you exercise the neck? Well, we're here already. Let's look at that real quick. Now, there are high-end devices, and then there's simple home things. So we'll start with simple home thing. One of the things I give most of my patients is what we call the Cardinal range of motion stretches. And what that does is it makes sure that the neck is being moved through all the 6 ways it moves. Every vertebra moves 6 ways. We look down, we look up, we turn to each side, and we tip to the sides. That's the one people forget, is the tipping. I always think it's like a dog hearing a funny sound, right? So you're going, what is that? Rotation is simple. You just should be able to turn 90 degrees. And if there's arthritis and a lot of neck problems, or you've had bigger injuries, you'll notice you'll turn one way and you will not turn very far the other way. And you'll feel pulling and pain in your shoulders. And these are signs that your neck is on the way to becoming arthritic and becoming a problem. Exercising helps it. So what we do is go through each of those movements, all 6, and hold them at the end play. So you go, let's say you turn all the way to one side. You hold it for 15 seconds or take 3 deep breaths in through your nose, out through your mouth. And what that's going to do is use the muscles of respiration during the stretch. And when you stretch and when you breathe, this basis of yogic postures, you actually, that breath is expansile. It's going to help you stretch. So you're going to get into the stretch, things will start to get a little looser. Then when you get that deep breath through your nose and breathe out, on the exhale, add a little more rotation, let's say, or any of the movements. And you do that 3 times to each of the 6 positions, right? So there's your basic Cardinal range of motion stretches. It's one of the simplest things you can do. It does use activity, so it is a strengthening and a stretching exercise. The next one is to simply lay on the edge of your bed. So you put your body on the bed and you stick your head over the edge. Let's say you're laying it, you start on your belly. So the bed ends right about here and your head is suspended off the bed. And then what you do is you let your neck come all the way down, and then you hold it up and then all the way back, and you hold it straight out again. And once again, you're going to do 15 seconds. We'll keep that number going. So it's 15 seconds of stretching down, 15 seconds of up. And be gentle. We're not trying to create any, trying to build Rome in a day here. And then we're going to hold it straight out, suspended for 15 seconds. And run through that 3 times. Then flip over on your back, stay in the same position relative to the edge of the bed. So the bed is here and your head's hanging off the bed. And do the same thing. Each side 15 seconds and then hold 15 seconds straight down. You're going to see these muscles tighten. You're going to feel muscles in the shoulders work. And that's the basic way of holding tension and getting rid of tension, but holding contraction in the neck to be able to create some basic neck strengthening that you can do it in bed at home without any devices. And that's at one end. That's where we start people. That's where people don't have a lot of integrity in their neck, and they're gentle, and they have comorbidities and lots of different problems. If I have a high-end athlete or a pretty good involved person, that stuff is it's pretty simple. And let's say they just want to they have some problems. They're using their phone too much, the ergonomics, and they're relatively young and healthy. Then I go and tell them to go out and get a device. Now, one is just basically called a neck harness, and I know a lot of weight trainers see these things. It's basically a device that's kind of velcros around your head, has a couple of chains that come down that you can put some small weights in, and then you can lean forward and move your neck through all the same cardinal ranges of motion, building some strength. And you can hold it 15 seconds, or you can just simply go through them, all the movements. Usually people are doing a lot of extension work because that puts that curve back, so you can do some of that. And then there's something called an iron neck, which is at the other level. It's a $300 device. It has, a series of ball bearings and stretchy cords, and you're moving your neck around in all different directions. It's by far the most superior way of strengthening your neck. That would be more for your high-end weight trained lifter, athlete, someone that's at the higher end. So that's basically the exercises. Now, in this same department, let's talk about curve restoration. Like I said earlier, there's the posture pump, a device you can go out and purchase. but the home version, right? You can take a 2-inch piece of PVC tube about that long, let's say that's 3 feet, and put it behind the neck while you're seated or standing. I prefer standing, but if you have balance issues or anything and you get vertigo easy, please sit for this. And you just push it behind the neck, right in the center of the neck. So it'd be kind of where I'm pulling my collar, and you just push forward and you rock real subtly back and forth 15 times, and then take it out there and sort of walk it off for a second, put it back in, 15 repetitions, push it back. Just put a little stress in the neck, and remember what you're doing. You're restoring the curve. So if the neck is straight, you put it in the back of the neck, and then you would push it this way in a sense, right? And then you rock back, and you'd be restoring that 30-degree curve in the neck a little bit and causing a little bit more alignment, which is going to bring muscle tension down and create a much better situation for circulation, positioning, all the stuff that is so important in the biomechanics, right? The biology and the mechanics associated with that. And when you get the biomechanics right, the neurology tends to follow, because the nervous system is pressure sensitive. So there's a lot of different devices you can use, but that simple PVC tube, about 2 inches in diameter and about 3 feet long, usually enough. You can wrap a towel around it, make it a little softer. That's not a problem. If you have a thin neck and the bony prominence is going to stick out, you might want to use a towel in there. And just create that stress to bring the curve back. It works great in the workplace. You can keep it by your desk and do some stretches, neck restoration movements with it. Real simple. Let's go to another question. Do headaches come from the neck? Yes. I think I mentioned a second ago, 80% of headaches come from the neck. And the way out of that is to do exactly what I just said. I really recommend treatment on this one from a professional as well. Obviously, as a chiropractor, we want to get in there and make sure the mechanics are right, and we want to rule out disease, because we want to make sure there's nothing else serious going on. Because headaches, as we've done in other podcasts, can be deathly serious, all the way down to just a simple allergy or something very simple, sinus pressure, a food you're intolerant of. There's I don't know how many reasons for a headache, but there's a boatload of them. So we want to make sure that we're covering the serious stuff as well. And there's nothing like a healthcare professional for that. Your primary physician, chiropractor. We don't prescribe medication, obviously, and that's not my favorite way to treat things. But getting someone with the ability to shoot CAT scans and all that obviously is crucial. But most headaches are coming from pretty innocent things in the neck. 80% are coming from the neck, and what I mean by that is those are innocent things coming from the neck. And unfortunately, I'm putting arthritis as innocent. It's not innocent long term, but it certainly it isn't a deathly disease. It's certainly in the beginning stages at all. So headaches come from the neck, and that's incredibly important that we know that. What causes neck pain? Well, misalignment, improper posture, trauma, emotional stress. Now, we said earlier that women are more likely to suffer head and neck pain than men. And we talked in other videos also, in other podcasts, about the effect of stress on the body. The psychoneuroimmunology one we did last week with Dr. Fred Clary, I thought was great. It's the biggest word we can find, and goofing around with that. But what an incredible topic to see how the mind, the thoughts affect the neurology, which then manifests into the detriment of your immune system. Hot topic right now, of course. But in this situation, we're saying that fear is a neck emotion. Guard our arteries from predators. We contract shoulders to guard the vital arteries and breathing apparatus. Because if you look at how lions and bears take out their prey, oftentimes they know the neck is the structure to take it down really quickly. So we have reflexively inbred these reflexes to guard our neck. So if we have a little bit of fear from our jobs and our relationships and our finances, we may hold a shoulder contraction that's barely visible, but do that for 20 years and find out what you feel. And you're going to feel trigger points in the muscles, sometimes numbness or tingling in your hands, headaches, and that horrible posture of head forward. Eye strain, ear ringing, jaw problems, dental issues. The list goes on. So it's really important that we pay attention to the many causes of neck pain, and of course medication and headaches. And medication could be another one. A lot of medications cause muscle contraction, and people can get that as like a hamstring or a calf or a foot, like old-fashioned Charlie horse type of spasm. But you can also get just an increased tension globally. And if you're adding stress to that, the emotion of fear, boy, that's really going to affect the neck, right? So massage therapy is crucial in something like this. chiropractic care, getting devices that create stimulus to the neck and the shoulder area. Very, very important. Another great question is, when is it serious? And neck pain is serious when you have headaches associated with it, because a headache can be a very serious condition. Numbness and tingling in the hands brings it up another level. If it's local neck pain, less likely to be a big problem. By the time it gets into hand numbness and tingling, something is crowding that area. Something's getting into the neurology, whether it be the spinal cord, where you'd usually feel it more in the whole body. Sometimes I have people that have such neck degenerative problems and problems in their neck that they actually, get weakness in their legs because their whole spinal cord is affected. But most of the time, those arthritic spurs and disc herniations and disc bulges touch the nerves that are running outside the actual cord in the center and touch the nerve roots. And those go down, the ones that come out of the neck go down into the hands. And people get their baby finger gets numb, or their thumb or their middle finger, and they're not sure if it's happening at the wrist, like a carpal tunnel, or if it's happening in the elbow, or it could be happening in the shoulder and thoracic outlet syndrome. But that's what a professional's job is, healthcare professional, chiropractor, physical therapist, to find out what is the neurology there, what's causing the problem. But that brings it up another level of seriousness. And weakness is one more notch above. When people analysis and see that a person should be about 10 pounds stronger on their handed side, especially if they're right-handed. Left-handed people still live in a right-handed world, so they use a little more, and they could be a little more even than a right-handed person. But when we're looking at strength, we want to see only a little bit stronger on the right side. So if someone comes in with numbness, tingling, and they think they have weakness in their hands, we check it either way. We'll see more than a 10-pound deficit in between the hands, and we start to think, we have some nerve pressure in this situation. So, neck pain can be serious. And I think the biggest one to look out for, which is, the least common, but also one of the most dangerous, is if you have neck pain and a headache and you bring your chin to your chest and you get severe head pain, especially if you have a fever, you could have spinal meningitis. That is a deathly condition. So anytime you get that, that is something that is to be taken seriously immediately, right? So fever, headache, and pain in the head, especially when you look down, that is something real serious. So that answers that one in the best way I can figure for is it serious. Now, where should you go with that? What should you do? What about the exercises? And I want to touch on food intolerances for a second, because so many foods are inflammatory. The way we grow our food, the different toxins found in meats when they're fed improperly, and the maldigestion that we have, all the GERD and acid reflux, hiatal hernias, irritable bowel syndrome, Crohn's disease, all these conditions add to a blood chemistry that can lead not only to headache, but to neck pain, joint pain in general. So you want to make sure your digestion is good. You want to drink enough water, because the discs are water structures. And we also want to make sure that we're exercising, like we said earlier. So when you start to take those things into account and work in those arenas, you're obviously going to decrease your likelihood of neck pain. Then the next level up would be something in the area of massage therapy, because when you get after the musculature, if a person's constantly contracting the musculature, you can decrease that tension, push blood through it, push lymphatic fluid through it. And some massage therapists will actually, move you to side and improve the range of motion of the shoulders and neck as they do their therapeutic movements into the shoulder area and the muscles. Also, to get into more details with that, you would go to the next level, and that would be chiropractic. Physical therapy fits right in there as well. Both those professions are going to be working on changing the mechanics of the neck. A physical therapy obviously can give you a lot of exercises, but the chiropractor does that on more in the massage world, but deeper, obviously, right? Massage therapy, think of muscles and ligaments and tendons, and chiropractic, think of bones and ligaments, or ligaments attach bone to bone. So that's the shrink wrap of the body. That spine I have here, basically the ligaments have been taken off of this. So you see bones, that's like the base of the skull there, but these are the spinuses in the back. This is shrink wrapped about 50 times with a nice covering that is going to that is ligament, that's going to be able to stabilize your spine and make it, give it an ability to be integrous, to all come together. But it, like shrink wrap, it has a stretch to it to some degree, not as stretchy as muscle, but a lot more than bone, right? So you have the bone, the ligament, then the muscle. So when you go into the chiropractor, we're looking at moving the positions of the bones through repetitious forces in very subtle ways relative to how far the spine can actually move to get those ligaments to be a little longer, right? To be able to break up adhesions in the joint surfaces and create a better environment for all the mechanics in the neck, and also give you great advice like I'm giving today to give your spine a better chance to align itself and do proper mechanics, right? So we looked at it emotionally, right? Fear is the emotion of the neck. Fear is a contractor. It causes us to guard our necks. Chemically, we're looking at digestion, water intake. We want to have enough hydration because those discs between the vertebra are very, very important, hydrated water structures. And we also want to look at the mechanics of the spine. Check the workplace. Make sure your ergonomics are proper. That chin should be high up. One of the things we can do is if you take your fist and you measure here, you put this right here and you put your chin down. That's as far as you should look down for prolonged periods of time in the workplace or even on your phone. I tell people to sit in a chair with their elbows up on a couple pillows. So their device is actually right here. I have armrests on this chair. I can take advantage of. If I was going to be texting for a long time or reading my phone, I might sit in this position instead of doing that. Obviously, we're looking down. Because this is actually supportive of the curve, especially if I use the PVC tube a little bit, stretch the neck out, and drank a big glass of water, and then sat here and did it. Thing would be kind of in an optimal position. So, like I say, we address things chemically, emotionally, and structurally. And so I hope to learn a lot about the cervical spine. I want to make sure that if you like these videos, you subscribe to the channel, give me some thumbs up. There's a load of books. We'll put one in the links on the bottom, and those devices, the neck harness and the iron neck, for people that want to go to that level and create that. But so be cognizant of your ergonomics at work. Make sure that you're drinking enough water. Make sure that you are paying attention to the chronic postures of your neck, especially sleep. A lot of people have too thick of a pillow, and so their chin is down. You can use that same test at night if you're laying on your back, let's say, even on your side. Try to keep that chin up. Opens up all the breathing apparatus in the sinuses and the throat, so you oxygenate your lungs properly, and you feel good and rested in the morning. Okay, guys. Well, thanks for tuning in today. We'll keep this thing going, and like I say, if you like what we're doing, give us some thumbs up, and we will see you soon. Have a great day.